it's a tremendous thing, the NHS, you know, and the people within it particularly.
I'm going to
So it was
criticise. I don't think it's tremendous at all at the moment.
well,
I
no,
think
but
I think it's horrendous, maybe not tremendous.
hi, I'm Daniel Wright from Deltira. Welcome to this episode of the Pharmacy Planet podcast.
Welcome to the Pharmacy Planet podcast, Dan. So let's just start off with who are Deltira?
Yeah, so Deltira is a team of focused and experts within their respective fields in health tech and pharmacy that have been working together now for the past 5 years to build a range of systems for community pharmacy to really help us to move from the dispensing era into the private services era. And to provide the infrastructure to do that in a really efficient way and to give our clients a real range of autonomy in terms of data and brand.
Oh, okay, Dan. So you provide health tech infrastructure for pharmacies, right? And that just sounds very abstract at the moment. But I think before we get into exactly what Deltira does, just tell us a bit about yourself, Dan. Where did you start? Are you a pharmacist? How did you get into this in the
Yeah,
first place?
absolutely. So I am a pharmacist. I'm a registered pharmacist. I haven't actually practiced in the past 3 to 4 years as I started to kind of move away from that in pursuit of other interests. But yeah, I went to Sunderland University in 2006, qualified in 2011. I spent all my career in community as a pharmacist, and that was with Peak Pharmacy Group,
Oh, right, okay.
who are a really good and valued client of ours to this day as well, which is
We
nice.
have to say that now if they're a good and valued client, right?
Yeah. No, to be fair to Pete, I think they were there at the very beginning of the Deltira, journey,
Okay.
in terms of the initial opportunity and platform to start creating some of the stuff that we do. And we very much enjoy supporting them just like everyone else really. So I think it was in around about the COVID era actually that I was doing I became a chartered manager. So I really wanted to kind of like go into more generalist sort of topics in terms of my personal career and development, away from pharmacy, but more thinking about how do we actually manage pharmacy or a healthcare system.
Okay, so you're in community pharmacy and you thought your skill set was better used elsewhere, so you decided to look into these other roles and then you got these other qualifications and then you thought, right, now what do I do? Right? Or
Yeah, but potentially, I'm sure we've all faced it at different times as pharmacists in our careers. We have our own version of what our career should be in pharmacy,
yeah.
and nothing goes to plan. So perhaps opportunities not arising when we would like them to progress and things like that, which is fine. Pharmacy's been changing so much as an industry, and as we know, margins are getting tighter. So I think management structures and things have had to become
Yeah.
leaner. So I actually then, with that skill set, went into management consulting for a sort of like a boutique consultancy,
Okay.
working for ICBs, hospital trusts, and
Okay.
even at a country level in Northern Ireland, where that skill set, whether it be discovery projects, whether it's be formal procurement projects of radiology systems within an ICB, going into several hospitals, how do we formally do that and assess those systems and understand the value? So that was my kind of intermediary before then Deltira quite clearly needed my full-time attention, which was about 2
Okay.
years ago.
So how did only 2 years ago, right? Is
Yeah,
that
we've
what
had
you
a
said?
very, very quick kind of period of growth, really. Yeah.
Okay. How did you get into Deltira? Who owns Deltira? Are you one of the founders?
Yes, I'm one of the co-founders. So there's myself and a superb chap called Dominic
Okay.
Good, who's a software engineer by background.
Okay, well, that's convenient for this sort of business, right?
Yeah, well, in my mind, when I was forming the company, it's effectively, it's a new journey. It's a new. If you almost imagine you've got a bus and you think, well, who do we need on this bus? What expertise do we need? And I mentioned at the beginning when you was asking me about, who is Deltira? Every single person in our team has got so much experience in their respective background,
Okay.
and we work tremendously well together. You know, as a really nice, agile, and supportive team. It's really enjoyable environment at the moment. So I think Dominic and myself, we're the majority shareholders in the company. We then have two more directors, which is our design director Frankie and our medical director Tom. Frankie's done some tremendous work in terms of front end web development. I think he actually built the Darktrace website, which sold for the company sold for 5.4 billion last year. So
Wow,
imagine
and
the
he's still working.
no,
You-
no,
you think you're-
yeah. So he was he managed
He
built
needed a little bit more.
he built and managed the website for that company.
All right,
Sorry,
okay.
but the budget for that was well, as you would imagine it would be for a multi-billion-dollar company. So tremendously talented, and he leads all the design across our platform, and indeed when we're providing websites as well for our clients, that's the man who's doing it.
Well, I'm surprised because there is so many other competitors doing similar stuff, and I think this is health tech across the board. Someone sees a gap in the market, they try and address that gap, and then it's almost like mission creep. You can't address that gap without addressing. There's another reason why they can't onboard you, and then you go into this other side. So, as an example, is anyone who's in health tech starts approaching, if you're approaching private services, you start approaching websites, you start approaching SEO, you start approaching integrations with NHS. It's just mission creep, right?
Yeah.
So there's so many people doing it. Like, if I would have thought that with so many people, the competition's just immense. What's so good about Deltero?
Well, firstly, yeah, you're absolutely right. I mean, you've got to focus and know what you can do, what you've got the capacity to do as a company,
Okay.
and stick to it, or else effectively you're gonna have that dissolution of resource and focus,
Yeah.
which means that all the individual parts of your system then aren't quite as good or as well maintained. So the idea of like the one system that does it all, I personally don't believe in. What we've defined Deltero as is private services infrastructure or pharmacy services infrastructure, for the moment, and staying well within.
But would you
those
say the
lanes.
core is private or just general pharmacy services?
The core is
NHS as
private.
well?
We're moving, of course, towards NHS
NHS
services. It's
integrations,
been a long ambition, and that will become part of the platform. Without question.
Now, how do you see how you guys fit in with PMRs or patient, the anchor product that every pharmacy has within every business?
Yeah, so we've got some really good conversations underway now with with some of the PMR providers. I think that's happened in a nice way where there's a prominent PMR provider at the moment, Apotec, who everybody's
we
speaking
use
very
them.
highly of. And again, I think that really in capturing a lot of that efficiency in those particular dispensing processes. So, and I agree, because when you get a private prescription out of Deltero, the core platform as it is now, or certainly with Prescribe, which is, we're going to be doing a lot of private prescribing for patients, is we want that to drop immediately into the workflow of the pharmacy.
Yeah.
And there's a range of things that need to happen. There's a number of APIs that are required to make that one simple functionality happen. Lots of verification, make sure that we send in, Daniel Wright, who's born on my birthday, my prescription to the Daniel Wright in the system that wasn't born on a different birthday. There's, and all these different things. So absolutely, I think something that's going to be happening. That's already started in a really nice way. And we've got our targets for interoperability on our roadmap.
Okay, so moving off Deltero specifically, as a general industry, where do you think pharmacy's at the moment? Where do you see it going? What's your thoughts on the farm? And when I say pharmacy, you work in community pharmacy, but pharmacy as a profession, medicine supply, what do you reckon?
I've become quite siloed in many ways just to pharmacy services, to be honest. So I'm genuinely
actually
not
don't have
aware.
an opinion.
No comment. When it comes to, but what I could say.
But you're gonna have to make something up on the spot. You
No,
can't actually say,
this-
so what you're trying to say is I actually don't have a clue.
No,
I only do
Oh,
pharmacy
go
services.
on.
Why are you asking me this?
Medicine supply specifically,
yeah.
pharmacy
You're
operations.
not going to get re-registered with the GPHC at this stage. You know what I mean? They're going to be like, this guy doesn't have a clue what a profession is. So yeah,
No, where I think it's going is absolutely there's a huge amount of opportunity that there are some people, some companies that are really working, very correctly and positively towards seizing that opportunity. And for example, I mentioned, we see adverts now on TV for non-pharmacy providers offering things like men's health services, erectile dysfunction, hair
Yeah.
loss, etc. And you think, well, that really, if we're doing things absolutely in the best possible way, should be a really good experience at a pharmacy or
Yeah.
maybe through their online offering. I think as now it's the biggest change in the sector, and change is only accelerating as well. It's only going to get faster and faster. But there's a huge transition from dispensing to services.
Yeah.
That's where 5 years ago, when our industry leaders were talking about that was a big driver. I thought, well, how do we do that? What
Yeah.
what's the system that makes that possible? And we've got to where we are today with our opinion on what that should be. I think now we've got the new IPs coming out. That's a great thing. I think there's a lot of governance that needs to be built into the systems for the superintendents and the professional service leads to actually manage that and support those people, rather than just saying, well, I've got access to a private a prescribing system and off I go. It's got to be
Yeah.
mapped to the competencies, individual people's learning and development, and all that. So that's a big heart. It's at the heart when I mention governance in Delta. It's all those structures that you don't necessarily see in terms of just using the system to consult and prescribe.
Yeah.
Really supporting the pharmacy. But within that, I think we really need to be thinking about sort of all the innovative ways across PGDs and across private services that we can serve communities and local health needs. And I think that will work really well also to encourage national commissioners to think, well, there's actually all this capability and capacity.
Yeah.
And it works itself back round then to hoping that, from national budgets we'll get commissioning for services as well. And but in terms of the NHS contract, that's the type of stuff that I'm not, I don't have any opinion on.
Okay.
Other than
okay.
it's rubbish.
Okay. In terms of health tech generally, I know you were in Dubai recently at an expo. Health tech is growing in the UK, but I'm finding that as an entrepreneur, growing a business in the UK, I think there's a lot of barriers. Yeah, there's a lot of barriers, and you sometimes wonder, is it even worth it? Yeah. So is it worth it? Because the amount of blood, sweat, and tears that goes into growing a business is mad. What's your thoughts on either the international market or health tech generally, or where you think Deltera is going to grow?
Well, we certainly, the UK is absolutely our base, our home, our
Focus.
our focus, without a doubt. What we can sometimes forget is how the natural regulatory environment and the level of excellence within British healthcare, full stop.
Yeah.
Particularly then with blending technology with healthcare, creates a really exciting offering for other markets in the world who have similar public health challenges to what we have in the UK. So we know we've got an obesity challenge at the moment. We've got issues in terms of capacity, full stop, in primary and secondary care. So when we look at the NHS 10-year plan, moving from hospital to community and moving from treatment to prevention, those problems exist in other countries.
Okay.
They're actually far less mature in many ways than our health system, as much as we can sometimes criticise it. It's a tremendous thing, the NHS, and the people within it particularly.
Well, I'm going to criticise. I don't think it's tremendous at all at the moment.
Well, no,
I think it's horrendous, maybe not tremendous.
Yeah, how it's being operated, absolutely. I think at the heart of it is an
inefficient
amazing thing. Yeah, absolutely.
And poor value for money.
Yeah,
the outcomes are not there.
Yeah.
What's so good about it exactly?
What's
What you were saying?
What's frustrating is you see. I speak specifically about the people, because you can always have the best systems things, but it always comes back to people providing care.
Yeah.
And we've got amazing people in the health service. Who
I
are
agree
doing
with you there.
wonderful things. I think if we give those people the systems and the efficiency, then it could really be a great thing. There's with 42 ICBs, each with their own sort of regional healthcare record, those things aren't interoperable. We don't have a national sort of database of patient data. That there's so many policy things that need change in order to simply say, well, let's just get a new IT system, and it's unfortunately not that simple. And that's what I certainly saw in my consulting days. It's pretty obvious what the solutions are, but there's so much policy and governance and bureaucracy restricting that. I think we do have some curiosity, I would say, at this stage in some other markets in the world where you can really see
Like
that.
which one? I'm curious as well.
Well, the Gulf states are really interesting,
I mean, the economies are flying there.
Yeah.
It's probably a bad word to use right now because there's like missiles flying around there at the moment. But while we're recording, there's the Iran wars going on. So
it's just beggars belief, doesn't it? What happens from time to time in our world that we're on this rock that we're on, we're just floating around in space, and these events happen. And
but other than that, in terms of the economies, they are absolutely flying. I find there's a kind of entrepreneurial buzz whenever you go to states like Dubai. It feels like everyone's trying to get on and move on and remove barriers, whereas I find trying to get anything off the ground in the UK, I'm finding that actually people find reasons to erect barriers, and you're forever just like, I find it's hard work.
It's definitely a systemic problem, because when you speak with your chief information officers, for example, of an ICB, huge role, they're in charge of all policy locally. They're absolutely hamstrung by regulation. So it's not their choice. It's just that, well, I can't do this because of this. Or if we approach that, that's going to be an 18-month programme that's going to cost X million pounds, and there's no budgets at the moment, either capital or revenue. So they're just in a place of stagnancy, really. I think, and that's what comes back to funding and investment, at that level. But also then policy isn't supporting in the way that we can see. They've got fewer restrictions in those states. But there's an argument then to be made is, well, have we learned some lessons that have informed the policy? Which, if you just released it and had that kind of more free-for-all approach, what would be the consequences to people at the heart of it? Patience, you just have to go, but what happens if this happens, and who's responsible for that? And there we go. Well, not me.
No, I think right now the NHS is shooting itself in the foot, because there's a lot of businesses that are kind of working on the periphery, private businesses trying to bring some entrepreneurial zeal to the efficient workings of the NHS, but because there's so many barriers, a lot of people are just turning away and moving to private service, and they're losing a lot of good entrepreneurial talent.
So it's selling to the NHS is tremendously difficult, because you can't sell to the NHS and it goes in across England. You sell to an individual ICB. There's 42 of them. So that you can imagine, if you want to put a product in England, you've got to do that 42 times, and they might have all different suppliers,
vested
for their
interests along all the way as well.
Potentially, I've generally, my opinion, I've met good people trying to do good things and are efficient and are using good methodologies to do it. It really has gotten it's grinding to a halt, hasn't it? I think we see that as patients now, which is a real shame. And then when they can't adopt those, there's people, you have like a clinical entrepreneurs program in the NHS, which I really like that. So basically saying, if you're a clinician, or if you're someone that works for the NHS and you've got a good idea and you think it's going to have a good impact on patients or efficiency, well, there are programs to develop that as well. But when you look at the overall uptake, it's quite low, really. And it all comes back to budgets, investments and...
No, I think it's decision making as well. People don't want to put their name to something, and signing off on something. It's
but then that's the bureaucracy. You do a full formal 5 cases business case to do that. Well, a decent one of them is going to take 6 weeks to put together. You're paying someone who can do that. It's a lot of money just to write a business case for this product, and it's and those are the things that would justify the investment over a life cycle within the ICB.
And if I was a business, especially a health tech business, trying to work with the NHS, I do think, do I spend the next 5 to 10 years, like working with them to try and integrate this, or is the opportunity cost? I've got to look elsewhere and see whether my talent or value can be. It's an opportunity cost, right? Spending that long time building that relationship and integrating something which might have little return at the end of it.
Yeah, absolutely. So and this is, I think, within any business, you've got to have variation, haven't you, across what you do. So with us sort of having more strings in our bow now, from websites to apps, you do need to kind of, create that variation, but also then in your market as well. So we've had a really and the growth that we see ahead is very strong as well, which is great. And that's certainly why the UK remains our focus. I think we've got real interest in some of those Gulf states, UAE, Saudi, But equally, I've heard, from people that currently do business in those states, that equally things can take ages. We suspect that they'll just go, yeah, that's a great idea. We'll buy it. Let's put it in place. There's times when people have gone from, they've had a year's pause and gone, yeah, okay, we're ready for it now. And there's no communication. And so the grass isn't always green.
Yeah, I think if you're relying on central healthcare systems to make decisions, it's not easy wherever it is, and
No,
it's difficult. But I think in terms of the private offering and potential uptake of health tech, it's a lot better in other countries.
Yeah,
I think.
I mean, World Health Expo was just crazy. I mean, our pharmacy show that we have every year, of course, in Birmingham is a brilliant event.
It's not brilliant. Why are you saying that? You and I both know it's not a brilliant event. If you go to the pharmacy show, I've seen it over the last 20 years, and now it's almost like a regional trade fair or something. It's the sort of thing you'd have in the middle of America, some unknown state in some unknown little town, and they'd have something similar. It's hardly the preeminent show of the UK. I think
Well, no, I agree with that. I went to the primary care show.
Yeah.
So you think, wow, that'd be bigger. That was woeful.
I can imagine.
It was
I've never
terrible,
heard of
yeah.
the thing.
Well,
do you know what I mean?
That was at the Excel in London. It was about the size of half a football pitch. Really poor offering. I think on balance, I think it's good. It's certainly from a social perspective, I love bumping into people that you went to university with. It's brilliant. You never know who you're going to bump into and have a big hug with and that. And but I think I like it. I think it's a positive thing. For the sector that we have that event that we can go to, and of course there's other ones now, that are popping up as well. So pharmacy shows are doing it. They're kind of we're in Northern Ireland with them in January, and we're at their event in September in Edinburgh. It's a much more focused kind of trade show, really.
Oh, right, okay.
I think it's better for suppliers, to be honest with you. But if you're a pharmacy owner, it's a real good collection of suppliers in what is becoming a more competitive market. Which is only a very good thing. Competitive markets ultimately are better for everyone within it, but they drive innovation and value for clients ultimately. So
so you think you were mentioning, but the Dubai one in comparison,
you
didn't finish.
Sorry, so the Dubai one was absolutely colossal. I would say. I mean, I'm trying to. It's dozens and dozens of the times larger than the pharmacy show itself in terms of a space, but you've literally got.
What sort of stuff have they got there?
They're absolutely mad on AI.
Yeah, everyone is. Aren't you guys? I was going to mention that actually. It's on my list.
Yes and no. I think we have a different attitude towards AI, and certainly there's a question then is firstly, is the AI offering truly AI, or is it just very good, clever coding?
It's just algorithms, isn't it?
Algorithms,
I think 99% is just algorithms. And very rarely is anyone offering anything else.
Yeah. So we could badge our product up and try and convince some people that it's AI and it's great.
You can't do it now. You've just told everyone on a podcast.
Well, this is just because we're a transparent and company with our clients. We want to deliver value and say exactly what it is.
Yeah, I think everyone's going to be integrating some sort of AI in their systems eventually. But I think everyone's trying to jump the gun a little bit by just calling their system or implying that their system is using some sort of real AI, where it's really not.
We're cautious. We want, we always want whatever we do deliver to the market has to be excellent because of what's
to be excellent.
Yeah,
Wow.
well, it does.
I like it.
If you think you can't deliver,
Can't be very good.
well.
It's not good enough.
Very good. Yeah. Well, was it? I think it was. Is it saying, isn't it? Like, good enough won't do or doesn't do or something like that. It's a good sort of thing. You say it's good enough, it's not. It's not good enough. Because that's not the. But it does. Because when we start thinking about prescribing for patients who are attending could be quite ill. They've got to decide, do we need to refer them?
They probably are going to be if they're patients, but yeah.
Well, all right. But, let's say someone attends acutely unwell.
All right. Okay.
You want to check, don't you, that you don't need to refer them for sepsis.
Yeah.
If you say, here's some antibiotics, you'll be better. Get in touch in 3 days if you're not better.
Yeah.
If you've not properly assessed, are they already at a stage of pre-sepsis and on all the appropriate safety netting? So as much as actually providing care, you want to document that the care you provided 2 years ago, if we suddenly find ourselves in coroner's court, It's actually really robust, and yes, it was appropriate that you treated them for that infection. There was nothing indicating at that point in time they should have gone to hospital. If in fact, let's say, heaven forbid, the patient died of sepsis 5 days later, you know, these things happen. So these are the things we need to build into the design of platforms, you know, that people are going to use.
Dan, as you know now that we ask our guests to support their own chosen charity and donate something towards it. So, who's your chosen charity? Why and how much are you donating?
Yeah, so I think this is a really nice part of what you do. Firstly, my chosen charity is Brain Tumor Research.
Okay.
That's in tribute to my dear late mother, who we lost 18 months ago.
That's
Yeah,
such a
so
shame.
we had 3 months from when we discovered.
Oh, so
You
it's
know,
quite aggressive.
very aggressive. Yeah, it was effectively, it was at the last stage. It was stage 4 glioblastoma when we had something the size of a ping pong ball, the back of her head, bless her, and a couple of other things. So she was 60.
Oh,
Amazing woman.
it's not old really now.
No. Amazing woman. Miss her very, very dearly, and yeah, and then in realizing, you know, once you're then in the thick of it, you think, well, what can we do? You know,
Yeah.
that kind of thing. Well, actually, you realize that for almost 2 decades, you know, there's not been any new treatments at all.
Really?
No, it's such an
Surprising, really.
yeah, which is sad, really. So you've got radiology, and then you've got I forgot the name of the chemo that she was on, but it's a single tablet. And yeah, she rang the bell, bless her. But then we lost her unexpectedly 2 weeks later. Yeah, so
It's probably catching it early, I think, is the key, right? So before it grows to such a
yeah,
size.
so I actually have a friend who I went to university with who's had a brain tumor for some time, and it's in a really good place now.
All right,
You know,
okay.
and you know,
That's
we
good.
we can only hope that, you know, new novel therapies come along, whether it be immunotherapies and things like that. But it's quite clear, you know, that there's not been any progress really, or there's been very limited progress. So just as we have other cancer charities, yeah, I'd like to donate £500 to that.
Well, that's great. Well,
Yeah.
I'm sure they'll be very appreciative. Dan, I ask everyone to join the revolution, yeah, which is to make pharmacy great again, yeah, because we've been going through a bad patch, yeah. So
We have, yeah.
So right now, pharmacy to join the revolution, we have loads of merch for a start. Now we've been mixing up with the hats lately. It's been
Is this because I'm from Manchester? You think I naturally
we think,
wear a bucket
yeah,
hat?
Yeah, we're gonna think you're gonna start raving. We're gonna give you an E-tab, turn the music low, put the music up, and then we're only joking, by the way. There's no drugs, but
Let's have a look. This is nice. Eh?
yeah. It's all,
What do you think?
All yeah, it suits you perfect. It's all Oasis.
I'll take you at
Yeah.
the next gig I'm at. You know,
Yeah.
I'm gonna have this on.
Are you a Manchester football fan as well?
I am indeed. Yeah.
City, United.
I'm really, really lucky in that my wife is a bigger fan than I am.
Oh,
So
really?
there's no trouble having the football on in our house, which is
That's a
yeah,
bonus. That's a plus.
I'm a lucky man. And in fact, her father, my father-in-law, great guy, has 2 season tickets at United.
Oh, really?
He's had them for 40 years. So yeah,
So you're
get
offering them out to anyone who's watching this podcast.
If you buy-
if ever you want to go,
you sign up to Deltira.
If you sign up to Deltira, he'll take you to a United game.
to the
that-
Theatre of
that's an
Dreams.
official thing,
to the
right?
Theatre of Dreams,
Yeah.
you know.
Well, it's not for me anyway because I wouldn't be.
Who do you
seen
support?
dead Arsenal
All right. Do you think you'll do it?
this season? If we don't do it this season, I don't think we're ever gonna
Do you think
do
you
it.
will?
Yeah, I think so. I think we're just gonna scrape by. I don't think it's easy, but I think we'll do it this season. Some more merch for you, by the way. Yeah,
thank you.
We need you to promote as much as possible. Yeah.
Yeah. Well, thank you very much, and thank you for having me.
Right, Dan, got the quick fire questions for you. As you may or may not know, they are AI generated. I have zero input into these. Yeah, don't you love it? AI generated. I love it. Not an
Well,
algorithm.
it would be scary if it is AI generated, how much it knows about me to ask
Well,
these
really,
questions.
Yeah. Yeah. But we're not going to talk about your drive down and any traffic or anything like that. It's not that specific. But okay, I'm gonna work backwards here on these. Okay, if pharmacy didn't exist, what career would you have picked? Hold on, I'm not gonna let you answer this yet.
Right.
I've got the team here. Yeah, And I just want to know, if Dan was not a pharmacist, what job do you think he would have been doing? You're gonna have to cut the silence out. Come on, girls, hurry up.
I don't know. I don't know.
What job do you think? Does he look like somebody who's a pharmacist? I don't think so.
No,
Look
I
at him. He's
don't
wearing a
know.
bucket hat, for God's sake. What job do you think?
In a band?
In a band.
No, I haven't got a musical.
play a musical
I haven't-
instrument?
No, I've got no
Oh.
rhythm.
Oh,
What do
DJ for a boiler room. Yeah. You can put
Really?
That on. Yeah, bucket hat, 100%.
DJ. A DJ. Is this all hat related now? Just
Yeah.
because you put the hat on?
I begrudgingly tried once for about 5 minutes on some debt, and it
Yeah.
just wasn't me.
Oh.
Yeah.
But I'll take that though. I'll
Yeah.
take that.
I think he would be good at some sort of customer relations. So I think he's fallen into the kind of
Really?
right job. Yeah, I think he'd be good. Yeah, you talk a lot. Right. So next question.
He didn't answer it. He
oh.
didn't answer it.
Oh, sorry, I forgot about that.
Oh my
Oh,
word!
yeah.
Well, I
forgot
got
about
into
that. Pharmacy
pharmacy
exists.
accidentally.
Sorry.
I got into pharmacy accidentally, or rather through clearing. So
Right, yeah.
I actually flunked my A levels
Because
I
you
was
wanted to do something else.
Well, I was on my way to medical school,
All right.
which is what I thought I wanted to do back then. I know because my wife's a doctor, I definitely couldn't
Yeah.
do that.
Yeah.
So that's a good thing. As much as it was dreadful, it was really sort of bad at the time. So I went to Sunderland through clearing to do
Yeah.
pharmacy, and it was.
I love
it
the
was-
way I did pharmacy. It was really bad at the time. It was unfortunate. I looked at any other job, any other
I went
profession,
to
but
Sunderland.
eventually that's all I could
I went
get
to
into.
Sunderland thinking it was on the south coast.
Yeah.
Not knowing
Sunderland
Yeah.
on the south coast.
That's where I thought it was. Like, where's Sunderland?
Oh,
you
you
know,
must
I
have
was
lived a
like,
sheltered life. Really?
well, you wouldn't. Why would? All right,
Yeah.
I'm not going to say why would you go to Sunderland. Yeah,
No,
but
that's a-
and yeah, not really knowing what pharmacy was actually. But my mum said, right, you're off to Sunderland doing pharmacy. I was like, am I? I was like,
Yeah.
yeah.
So,
Okay.
so you've got your mum to thank.
And then here we are.
So what career would it have been? So you would have picked medicine.
That's what I thought I wanted to do.
And
That's
now?
that's what I was going. Now I think it is an
If
interesting.
pharmacy didn't exist.
If I had to start again now from this point forward, bear in mind, they say that AI is going to take over and all that. I am quite handy, plumbing,
Yeah.
joinery, that
Right.
kind of thing. And I often say that, if you've got a leak, AI is not going to come and fix that in the next 20 years. So I think.
Well, that's
I'd probably
handy
go-
because if
yeah.
ever we have Deltera and he's by and we need some bits and bobs doing in the pharmacy.
If we're quiet, you never know. One
Yeah.
month we might have nothing.
Yeah,
I can come and have a look. you
Right.
know.
Okay. All right. Sunday roast or takeaway? If it's a takeaway, what are you having?
Sunday roast is awesome. I'm too partial to a takeaway at the moment.
Which one? Any specific?
I love a madras. I love a chicken tikka masala.
Indian curry.
Yeah. But I also love pizza,
Okay.
and I'm really fond of Chinese. You can see the problem I have.
Yeah.
At the moment,
You eating a lot of fatty foods here.
Yeah.
This does not help. with
Stress.
the-
They say when you stress, you gravitate towards fatty food. So
Is there any food you've missed out? I like pizza.
All
I
the
like
foods,
takeaway,
all the
I like
takeaways,
this,
yeah.
I even like the
I don't
Sunday roast.
discriminate, mate. That's what
Right. Okay. We've kind of done this one, but it's come back again. AI in healthcare. Okay, let's keep it short and different if you can. Exciting opportunity or slightly terrifying?
opportunity.
Yeah, it's
I think we have providing
You can
good.
kind of see that happening, can't you? With these systems start thinking for themselves and
Well, you pair it with robotics
Yeah.
because that's the thing people aren't talking about. Well, everyone's got AI mad, but at the same time, you've got robots, humanoid robots. Well, you put those two things together,
Yeah.
force for good. I mean, think about care of the elderly, bathing and
With
all
a
those kind of
robot.
things. Yeah,
it's a bit creepy.
it is, but I think that's what we're going to be. I'd rather that than Terminator.
Yeah, okay. Thank you so much, Dan, for joining us for the Pharmacy Planet podcast. That's a wrap.
My pleasure. Thank you for having us.
Thanks.
And there's always been.
Huh?
You know you're missing.
No, he's going to say it.
He doesn't know what to say.
He does.
Why is
He
it?
does. Like, subscribe, and share.
Like, subscribe, and share.
No, not literally, Dan. You
Why
can say,
not?
thanks for watching Pharmacy Planet podcast. Like, subscribe, share.
Oh, right. Okay.
Oh,
Yeah.
You can do that then. Go on.
Thanks for watching this episode of the Pharmacy Planet podcast. Make sure you like, subscribe, and share.
Love it. That's how I know you watch YouTube. You just reinvented it.
Yeah. It was so good as well.
Yeah.